In your morning medical news, the first measles death has been reported in the West Texas outbreak. State health officials say the school-aged child who was not vaccinated was hospitalized last week. There are now 124 confirmed measles cases so far in this outbreak, which started in late January. Most are kids and have been hospitalized. Meanwhile, a key March 13th meeting of FDA advisors to select this year's flu strains has been abruptly canceled. A committee member says it's unclear who ordered the cancellation or how many manufacturers will now get guidance on vaccine composition. The Department of Health and Human Services hasn't commented on the situation. If you use Sinocleanse nasal wash, check your bottle now. A contamination recall is in effect. Ascent Consumer Products has pulled its soft tip squeeze bottle kits distributed nationwide. The affected products, you're seeing them on your screen here, come with 30 saline packets and expire December 31st, 2027. Stop using the products immediately and return them to the store or throw them away. During this Black History Month, we're looking at peripheral artery disease that can lead to heart attack and stroke. The condition involves the buildup of plaque in the legs, and it affects more Black people. Yet, as Audrina Sinclair shows us, there's also a lack of diversity among the vascular surgeons who treat the disease.
Eunice Golar was diagnosed with peripheral artery disease several years ago and needed vascular surgery.
I had a pain in my leg. I couldn't walk. They found out I had a blockage.
The 74-year-old sees vascular surgeon Dr. Chelsea Dorsey at University of Chicago Medicine every year for a checkup.
It's much easier to relate when someone at least looks like you, has the same color as you have. And it has always been my delight to have a Black physician.
Black Americans are more likely to suffer from PAD and need to undergo amputations compared to white Americans. Yet, less than 2% of vascular surgeons are Black, according to the Society of Vascular Surgery. Dr. Dorsey says the lack of representation combined with historical mistrust of doctors can have a big impact.
One of the things we really need to focus on is ensuring that our vascular workforce is diverse and that it represents the patients that we're actually treating.
She points to research that shows when doctors are the same race as their patient, patients are more likely to adhere to the doctor's recommendations.
I'll often walk into the room when there is a Black patient. You can kind of see their body relax a little bit. And this is not to say that white doctors can't form that type of relationship, but sometimes it can be just a little bit easier to get to that kind of trusting relationship.
Eunice encourages other patients to not ignore the symptoms.
When you're having pain in your legs, you need to go have it checked out as soon as possible.
Her exam looked good, so she will follow up with Dr. Dorsey in a year.
Other risk factors for peripheral artery disease include older age, diabetes, smoking, high blood pressure, and cholesterol.